Hi, my name is Mackenzie, and in this presentation, I'm going to talk about the disparities in maternal health care, especially as they affect African American women in the United States. This presentation will be broken into 5 parts addressing each section of our project. In Chapter 1 is the introduction. African American women continue to face significantly higher risks of maternal mortality and morbidity compared to other groups. This introduction aims to explore the systemic, economic, and geographical barriers contributing to these disparities and the ongoing efforts to diminish them. The problem I will be addressing today is the persistent and disproportionate rate of maternal mortality and morbidity among African American women. This disparity is not just a health issue, it's a glaring indication of systemic failures in meeting the unique healthcare needs of this demographic. This study is committed to unraveling the complex barriers that affect this situation. The purpose of the study is to investigate the barriers, systemic, economic, and geographical, that impact African American women's access to maternal health care and to use this understanding to suggest actionable strategies that can make a real difference. The primary research question guiding the study is, what are the systemic, economic, and geographical barriers that contribute to the disparities in maternal health care for African American women, and how do these barriers impact maternal health outcomes? Before we proceed, it's important to acknowledge the limitations of our study. These include potential biases in data and the ever-changing landscape of healthcare policies and the challenge of applying our findings universally across different states or regions. Our study specifically focuses on the United States healthcare system with a concentrated lens on African American women. It does not extend to comparative analysis with other countries or minority groups within the US. This study will help shine a light on the critical barriers that lead to healthcare disparities. Understanding these can guide us in developing targeted policies and interventions specifically tailored for African American women. We will start with a detailed literature review, followed by our methodology, findings, and finally discussions and recommendations based on our research. This literature review aims to dissect the systemic, economic, and geographical barriers that contribute to this disparity and understand the gravity of the maternal mortality and morbidity in the US. The background of maternal health in the US reveals a disturbing trend. African American women are disproportionately affected with a mortality rate 4 times higher than their counterparts. This forms part of a broader crisis where the US faces higher maternal deaths than any other developed nation. There's a complex web of barriers faced by African American women. Systemic issues, including racial bias in healthcare, lead to inadequate care and mistrust in the system. Economic disparities limit access to quality care, and geographical challenges hinder access to necessary healthcare resources. African American women encounter unique challenges in maternal health, exacerbated by a higher prevalence of chronic conditions. They faced an increased risk of severe complications, with issues such as preeclampsia and eclampsia being more prevalent and more deadly. These disparities highlight the need for improved healthcare tailored to their specific needs. Numerous initiatives are underway to address these disparities. Programs like the Alliance for Innovation on Maternal Health and the Black Maternal Momnibus Act focus on educating healthcare providers about racial disparities. However, the US still grapples with a maternal health crisis that demands a more comprehensive approach, including the expansion of the workforce and integrating doula support. To conclude, while there are efforts to address these disparities, there's an urgent need for more research and comprehensive strategies. We must continue to strive for a healthcare system that provides equitable and effective care for all, particularly for African American women who face these daunting challenges in maternal health care. The methodology chapter serves as a roadmap for the study. It provides a detailed description of the research design, population and sample selection, data collection methods, and analysis. The goal is to offer a clear understanding of how the research was conducted and to allow for the study's replication. For the study, I adopted a mixed methods approach, combining both qualitative and quantitative designs. This approach enhances the effectiveness of the findings Quantitative methods help in collecting measurable data for generalizable results, while qualitative methods offer depth through personal experiences and perceptions. Our survey instrument, which includes both open ended and closed ended questions, is central to this approach. The study focuses on women 16 to 60, offering a broad spectrum of experiences in maternal health care. I utilize purposeful sampling, selecting participants based on their relevance to our study and their willingness to participate. All data collection was conducted anonymously to ensure confidentiality. The primary tool for our data collection is comprehensive survey included at the end of my paper. It features a mix of quantitative and qualitative questions with responses measured on a Likert scale for attitudes and perceptions about healthcare access. The survey covers demographic information, healthcare access, pregnancy related experiences, and personal encounters with healthcare providers. For the data analysis, I used statistical methods like frequency analysis and cross tabulation to examine the quantitative survey results. Qualitative responses were analyzed thematically to exact key themes and insights, providing a richer understanding of the barriers in maternal health care. The study followed a structured procedure, including participant recruitment through social media and community groups, data collection via online survey, secure data handling and anonymization, and through analysis using statistical software and thematic coding for qualitative responses. We also included follow up options for participants. The methodology was carefully designed to capture a comprehensive view of the barriers in maternal health care for African American women. This approach ensures that our findings are both reliable and insightful. For the results section, I will talk about the theoretical exploration of the results that might emerge from a study on maternal health care disparities among African American women. This hypothetical analysis helps us understand potential systemic, economic, and geographical barriers. As stated before, the study uses two types of data, quantitative and qualitative. Theoretically, the quantitative data from the survey would be analyzed for frequency distributions and cross tabulations. The qualitative data, consisting of responses from open ended questions, would aim to reveal common themes and experiences regarding maternal health care. In the hypothetical quantitative analysis, there was a significant portion of African American women reporting low access to health care. The barriers, primarily cost and distance to facilities, could be more pronounced for them compared to other groups. This would indicate significant economic and geographical challenges. For a qualitative perspective, there was personal stories revealing bias and discrimination in healthcare settings. These narratives could illuminate challenges in accessing prenatal and postnatal care, often tied to economic or geographical hurdles, and lack of sensitivity from healthcare providers. Interpreting these hypothetical findings, it becomes evident that African American women could face multiple barriers in accessing maternal health care. The quantitative data would underscore the prevalence of these issues, while the qualitative data would add depth, showing the real life implications of these barriers. The implications of these theoretical findings suggest a pressing need for policy intervention. It's not just about addressing economic and geographical barriers, but also confronting systemic bias with healthcare institutions. These findings could be pivotal in guiding healthcare policymakers and practitioners toward creating a more equitable and effective healthcare systems. To conclude, this theoretical exploration provides insight into the critical barriers that could affect maternal health care for African American women. As we look ahead, these hypothetical findings underscore the importance of creating a healthcare environment that is equitable, inclusive, and responsive to the needs of all women. In this final part of my presentation, I will explore the conclusions and recommendations from the study on barriers to maternal health care for African American women. My study explores systemic, economic, and geographical barriers impacting African American women's access to maternal health care. It addressed the significant disparities in maternal mortality and morbidity rates. Employing a mixed methods approach, I analyzed both quantitative and qualitative data from diverse demographics, providing a comprehensive view of the factors contributing to these healthcare disparities. Based on my hypothetical findings, I can draw several key conclusions. For systemic barriers, there's a notable presence of systemic barriers, including implicit racial bias and institutional practices that disadvantage African American women in healthcare. For economic challenges, economic factors significantly affect their access to quality healthcare services, highlighted by wage gaps and insurance coverage disparities. For geographical disparities, the study also points out to geographical location as a crucial factor impacting healthcare access. And lastly, cultural and racial sensitivity. There's a clear need for increased cultural and racial sensitivity among healthcare providers to improve health outcomes. From these conclusions, I propose several targeted recommendations. The first is policy reforms. Educational programs on racial bias for healthcare professionals to tackle systemic biases need to be implemented. Second, there needs to be an enhancement of economic accessibility of healthcare through expanded insurance coverage and strategies to reduce healthcare costs. Third, there needs to be improvement in the availability of healthcare facilities in areas predominantly inhabited by African American communities. Fourth, there needs to be a push for cultural competency training by introducing mandatory cultural competency training for all healthcare providers. Next, community based programs need to be strengthened, and nonprofits need to assist African American women in navigating the healthcare system. And lastly, further research needs to be done to find effective interventions and strategies to diminish disparities in maternal health care. In conclusion, this study provides actionable steps for policymakers, healthcare providers, and leaders towards a more equitable healthcare system. These recommendations are aimed at enhancing the quality and accessibility of maternal health care for African American women, moving us closer to a future where healthcare equity is a reality for all. Thank you for your time and engagement in this important discussion. And then here are all the references I used in my paper.